So, good evening, everyone. This is Srikanth, resident of Frisco from Richwoods, and this program is being organized by Bharti Foundation. So, Bharti Foundation is a vibrant organization which predominantly works on the cultural aspects of India and also organize yoga and meditation camps. Yeah, some probably can I mute?
I think mute everybody, Srikanth. I think
Yeah.
echo.
Okay. So Bharti Foundation is a vibrant organization which predominantly works on the cultural aspects of India, as well organize yoga and meditation camps in the Frisco city area. So it's been more than a month that we've been quarantined, and how long it will go, we need to wait and hear from the doctors. So amidst all this confusion of social media influence regarding COVID-19, we might not know what to believe from the social media. So in these circumstances, we thought we should get some clarity from the doctors who are the frontline soldiers in the war on Corona. And they are the people who are in the front line along with police and hospital staff. We hope all the participants here are maintaining proper social distancing and staying safe. So today on the call we have doctors from Frisco and especially from Richwoods, and we need to hear from them what it is about COVID-19 and what happens aftermath. So let me introduce the doctors on the panel today. We do have Dr. Anurag Dugal, who is currently practicing on clinical infectious diseases. He moved from Cleveland, Ohio, and he has a special interest in emerging infections and has earned accolades for teaching best clinical practices at various institutions. He was also recognized as a Physician of the Year in Cleveland Clinic Medina Hospital from Ohio. So, welcome, Dr. Anurag. Welcome, sir.
Thank you. Thank you, Sri.
Yeah. And we also have Dr. Yamuna Gurapu. She's a certified internal medicine and also obesity medicine, and she is serving at the state of Texas since 2008. She too have won many awards for providing quality patient care at Baylor's and got Most Courtesy Physician Award in the Credentialing Committee at Texas Health. So, Dr. Gurapu, please welcome to the conference call. And we have Dr. Sunil Tumala, who is a certified neurologist who also did his MBA on health sector management from Canada. He has his own clinic in Frisco and Paris, Texas. He is a profound reader and a speaker who thinks rationally, and he can explain very well where philosophy connects with science. He'll be hosting this call today. And we have one other prominent personality from Frisco City leadership here. He was the first chair of Indian Affairs Committee, which sits under the mayor, and he holds many voluntary positions in Frisco City. And he's also running for the Frisco City Council this year. Welcome, Ram. Welcome to the conference call.
Thanks, Sri. Appreciate it. Thanks for the opportunity.
Sure. So now I will give it to Ram so that he can give us some info on how Frisco City is handling COVID-19 pandemic situation. Ram, please stay.
Perfect. Sri, would you mind make me a presenter?
Oh, sure.
Yes.
Yeah, hopefully you got it, Ram.
Yeah. Okay, let me start sharing. I'm going to share all my desktop and everything so that everybody can see it. So Sri, can you see my screen? You can see my screen, right?
Yeah, I can see you, Ram, not this one yet.
Okay. Let me share. Come up now. I just started sharing, so it should show up the entire screen.
Yeah.
Okay.
Yeah.
Okay, it's coming up. Still, it's rotating. So.
Yeah. We can see the mouse going in this.
Perfect. Okay. Awesome. Let me minimize this, and then I will quickly go. Okay. Thanks, everyone. And I will not take a lot of time. So, as Sri did make a great introduction. So, one thing I do want to highlight is I have a lot of experience working with healthcare companies like United Health Group. I was helping for last 7 years. And then also I worked with the state Health and Human Services. And currently I'm actually helping our DC Health, the Washington DC Health. So we are actively working to set up a call center for their technology department. And one of the big items, if you all can imagine, is the COVID-19. So that is just from my healthcare background. A couple of things, what I'm trying to show here is, and we're going to share these links. This is our Texas Health and Human Services. This website has all the numbers from a state perspective. This gets updated on a regular basis. So if you look at it, this is the national numbers. And then here we have the state level. So, yeah, good.
Browser is not visible.
Yeah, actually, we cannot see the screen.
Oh, okay. Let me just try it again, okay? So one more time I'll try it. If not, then give me 1 second. Sorry about that. So
we can see the screensaver.
Yeah.
Oh, okay.
We can only see the desktop.
Okay, let me stop it and let me present it again. Let me share the entire screen. So Sri, you might have to make me a presenter again, please, if you don't mind. Yeah, okay.
Yeah, hopefully you got it.
Okay, let me share everything here. So the page. You can see my dashboard and everything.
Yes, we can see that.
Okay, perfect. So a couple of things. We will share these links right after this call. This is the Health and Human Services side of the numbers. This dashboard gets updated on a regular basis. And so this is your national number, which everybody is seeing on all the news channels. But at the state level, we're looking at 24,000 change, especially for the cases reported. State of Texas has around like 648 fatalities. And then around 10K plus change of patients has been recovered. So this is very high level at a state level, and we'll share the link. If you come back to our city of Frisco, so the city of Frisco, if you do not know, is combined the counties, right? Denton and Collin County. So this is an interactive dashboard which is put in by our city IT department, and this has all the information on a real-time basis. What is happening at a city level. So if you look at our city, we do have 130 confirmed cases to date, around 32 are active, 97 recovered, and then we do have like one fatality or one death, right? So from our city of Frisco perspective. And then here is the breakdown from a Denton County perspective. So we have 51 confirmed, 14 active, and then 37 recovered, and 0 deaths, especially in the Denton County side. And the Collin County, we have 79 confirmed, around 18 active, 60 recovered, and then we do have, unfortunately, 1 death. And this is the combined dashboard for the city of Frisco. And then, again, I'll share this link, and also Sri will send this information, which is the website which updates regularly from the city of Frisco. And from the city of Frisco perspective, we do have a dedicated website, which is friscotexas.gov/coronavirus. So here is all the information we have, and I think one critical thing, we'll share this information here, is that there is actually a 211 number which was set up by the state of Texas, and that is a number which was dedicated for COVID-19, and you have this information here if somebody wants to call the State Department. At a city level, again, from testings perspective, these are some of the local hospitals which are providing the testing or screening. Baylor, Scott and White, and then also the Centennial Baylor, Scott and White. Texas Human, which is the health resources, there is a number here, hotline number, and we'll put this into the chat for information. And then also the medical city of Frisco, which is actually in the Frisco downtown. These are some known hospitals which are actually providing the screening services if somebody needs to go. And I think right now we are actually doing good from a city perspective from whatever the information I was actually capturing at the website. We do have a stay-at-home order, so this was updated on April the 23rd. So a couple of things which happened is we do need to maintain that 6 feet distance, and then also the parks has been open with like around 6 people, not more than 6 people. And then there is also a lot of information for the stay-at-home order, and we'll share this information right after the meeting is over. And then the last one I do want to share is that Governor Abbott actually released an order for retail to go, and then our city actually followed that same state of Texas governor order, and basically we do have a retail to go, and this is a valuable information from our Corona website for the city of Frisco, which actually tells what exactly is retail to go. So here is the details of people who are working at the small businesses. And for them, the retail to go is very critical because they have to make sure that they are following all the guidelines from CDC and also at a state level. They're also wearing the face masks and sanitization and everything. This is from an employee perspective. From a customer perspective, you can go in and pick up, or also there's a delivery to your doorstep or by mail. And then you can also pay by phone and whatever is the easiest way to keep us aware, right? So this is a retail to go, which we are amending from whatever the state of Texas governor has released in the executive order. And again, like this is a very high level information, but all these 5 websites are getting regularly updated, and we will put this across after this meeting. That way, if anybody wants to review this or view this, you will have all this information. So with that said, let me actually give it to the experts. And first of all, I want to say all the doctors, I mean, this is so complicated situation. I don't think that this country or the entire world have ever gone through this critical situation from 1918 all the way from, it's back. Nobody in this on the phone here is even alive, right? So we salute you for your dedication, for putting your lives for us. And we are really thrilled that you guys are actually going to provide us a lot of facts today. Thank you. And you can take it over, Sunil, from here.
Srikanth. You can mute everybody except Dr. Dugal and Dr. Gurapu.
Yeah. So right now, I'll hand over the call to Dr. Sunil Tumala, and he'll be hosting the call with Dr. Yamuna and Dr. Dugal. Let me mute everyone. I actually muted all of them. I'll do it again.
Thank you, Srikanth-ji, for arranging this event. And thank you, Ramji, for giving us the details about the Frisco City statistics. And thanks for all the audience who are joining us today. And again, thank you to Dr. Gurapu and Dr. Dugal for spending time with us and giving us these details today. So hopefully this will be helpful for everyone. And it is an educational event intended for the community members to get to know more about this virus outbreak and make an informed decision. It is in no way a medical advice. So I just wanted to clarify this. This is not a professional medical opinion for an individual. So, if you have any specific questions, you should consult your doctor. So with that disclaimer, I will go ahead and ask questions to our guests today. Dr. Dugal, please explain to us what is this COVID-19 and why is it different from other coronaviruses or flu viruses?
Yeah, so thank you so much for having me. So COVID-19 is basically, it's a different form of a coronavirus, which is, CO is for corona, BID, or COV is for corona, and then ID is infection, and then 19 is 2019 when it was diagnosed. That's why it's called the COVID-19. That's a short form of it. There are multiple other viruses that we deal with on a regular basis that can cause upper respiratory cold-like infections, and those are the coronaviruses and other viruses as well. But this is a different form of a virus which is highly contagious and highly infectious. And the difference is between influenza or flu and coronavirus or COVID-19 is that it is highly infectious even when you're asymptomatic. So even before you develop symptoms, about 3 to 4 days prior to developing symptoms, you are highly contagious and you can transmit the virus to others who are around you. Flu, on the other hand, you start becoming contagious when you start developing those body aches, the fevers, and whatnot, and that's when you start becoming contagious. So that's a big difference between the COVID-19 and the flu virus. And also the other thing is the duration of incubation. You can have about 3 to 14 days before the COVID-19 symptoms present. And most common symptoms are fever, cough, shortness of breath. You can have headaches, you can have muscle aches, and this new symptom that people are reporting about, loss of smell or taste, is also a new symptom that has been reported. And flu, you know, all the symptoms that are typical of the flu, you know, body aches, fevers, you know, you can have muscle aches as well. So those are the very typical symptoms of flu as well. So in general, what I'm saying is this is different from flu because of infectivity, because of transmission during asymptomatic phase, and also in, you know, if you look at the numbers so far, the case fatality rate or the mortality rate is higher, about 2.5 to 3% as compared to flu, which is less than 0.1%. So those are the differences between these viruses.
That's very helpful. And Dr. Gurapu, you probably are seeing a lot of patients in your practice right now with COVID-19. At least I think we talked, I think an hour or so ago, you saw some patients. Describe us, who are the patients who are at risk?
Thank you, Dr. Dugal and Shrikant Garu, and rest of the audience for giving me the opportunity. And it's my pleasure to be here in this session today. And thank you very much for all the North Texas community and Frisco community staying home and maintaining the social distancing very well. So I was rounding in the hospital probably like 4-5 weeks ago, Texas Health Plano, and the situation was really kind of scary actually, because we don't know anything about the virus. We don't know what is the treatment going to be, and we don't know how we are going to be seeing the patients. And we were almost like protected, you know, people are coming really sick to the hospital that time. And we were testing, you know, there were not enough testing kits actually that time. And slowly we started learning a little more about the, you know, virus. And I'm also as an outpatient physician, we started protecting ourselves and started screening the patient over the phone. And the patients I have seen in my practice are younger people actually, like 32 years to 35, you know, that's the age group I saw. And in fact, the symptoms are really milder symptoms like a sore throat. And one of my patients was having little high-grade fevers and like a 103 fever, like a flu, completely flu-like symptoms, you know. So the patient, when he came to the clinic, actually, we were like, I was suspecting like high suspicious for COVID-19, and it's a community acquired, you know, no other, like he was not traveling, he did not have any contact with COVID. It's like a community acquired. He was going to a grocery store. We were like hunting him, you know, like where did you go, you know, what you did. So the people I have seen as an outpatient setting, and luckily my two patients, which they are recovering very well at home actually, with self-quarantine and, you know, some medications we are using. So Frisco has actually better younger population compared to kind of, you know, other cities, you know. The risk category I would say is more than 65-year-old. And the hospital setting, we are seeing older people with a lot of comorbid conditions. And outpatient settings, I'm seeing more of the younger people actually.
Got it. Thank you, Dr. Gurapu. Uh, Dr. Dugal, I at least read one article. It says that some of the people are developing only GI symptoms. Is it true that only GI symptoms can be a manifestation of this COVID-19?
It's possible, but that's not the main symptom that I would want to advise everybody for. I think majority of the patients still have respiratory symptoms. So you have about 80 to 85% of the patients have fevers, and then about 70 to 80% of the patients have cough. So those are the two most common symptoms. In fact, when we screen them, when people go to the emergency rooms, and we know the testing is not very, not available a lot in most of the hospitals, if they don't have a combination of fever and cough, most of the hospitals will not screen you or do a coronavirus test on you because they want to make sure they only test people who have typical symptoms. So if someone shows up with GI symptoms to an ER, they probably will not be screened for coronavirus. Because right now, the tests are very limited. If we had abundance of tests, then maybe people can be tested. But I want people to understand that still the most common symptoms would be fever, cough, and maybe shortness of breath.
Yeah, I think, I had a few patients who call me complaining of GI symptoms and diffuse body pains, and they're reading on the internet that it can be a symptom of COVID-19 and they want it tested. So I have to convince them this probably is not a good idea. Okay, yeah. Good. So any complications from this COVID-19 that people can get it while they're at home, not at the hospital, but while they're still at home?
Sure. So when let's say if someone calls me and they tell me that they have some fevers and body aches and a cough, and I suspect that they may have coronavirus infection. As long as they are breathing okay and and they're not feeling dizzy, or lightheaded, and a lot of people, when this all started, they started buying these portable pulse ox meters, which you can put on your finger and check your pulse ox, which is basically the amount of oxygen you have in your body, and it needs to be above 92%. So if your pulse ox meter shows that your oxygen level in your blood is less than 92%, that may not be a good sign, okay? Or sometimes if people notice that their lips or ears or nose or fingers are turning blue, that's also not a good sign. That means your oxygen level in your body is low. So those are the things that I would look for to see if there's any complications developing, and otherwise people who are staying at home and they don't need to be hospitalized.
So the patients who have fever and cough essentially could have COVID-19. So Dr. Gurapu, what is the kind of profile of the patient who can go to the doctor for a testing? Like, we don't want to screen everybody. Obviously, fever and cough is one combination. Is there anything else that we need to worry about when they are at home but having concerned about COVID-19?
Yes. So the first foremost thing everybody has to kind of understand is, like, any symptoms, the first thing they have to call the healthcare provider, like a primary care provider first. Like, it doesn't matter whether you have a contact or not contact, having no travel history, just give a call to the primary care office and they will have a phone screening. They can do it over the phone. We'll ask simple questions about like certain questionnaire, and if we suspect that, somebody is at risk for having the COVID-19, we will let the patient, we'll arrange a televisit for them, and then we'll screen, like, on the televisit, and then we can decide which way to go. So most common symptoms, as I said, Dr. Dugal said, fever, cough, and shortness, like a bronchitis, cough symptoms. And I have patients complained with just purely sore throat and fever, and the patient was positive actually, without any lower respiratory symptoms too. And there are some atypical symptoms which are very rare, but we do focus, because our testing limitation is so limited, our testing capacity is very limited, so we have to prioritize which patient we have to test and which patient we cannot test. Even if the patient is having, as Dr. Dugal said, like shortness of breath, so before even, we were told from the ER and from our physicians, the pulmonologists, first we have to call patient, when they call us, they will communicate through ER and said, hey, you know what, my patient, I'm sending a patient to ER, and please make sure, this patient is going to arrive, Or, we have just severe cases, obviously, we don't have a choice, call 911, but we have to get in touch with them. Hey, there is a high risk of COVID-19, And the symptom, you said the symptoms, like extra symptoms, right? You're asking?
That's right.
So a sore throat is one of the things, and I have one patient complained loss of taste and also the smell, but he's negative, that's one of the other symptoms I was kind of worrying, and he's like a construction worker out there. And I have the patient nausea, the diarrhea symptoms and GI symptoms, but we don't screen. As I said, it's a very, very like a limited case report we have available actually, so we don't test for those. Most of them are like upper and lower respiratory tract symptoms. We do. I'm facing it in Frisco.
Right. Thank you. Dr. Duggal, what kind of testing is available in Frisco?
So testing it's a nasopharyngeal, or it goes in the top of your nose. They put a swab which goes all the way back to your nose, and it's painful. That's the swab that they run for looking for the virus, because the highest amount of the virus is in your nasopharynx, or the upper part of the nose. And that's the most common test we run, and that test is sent for a technical term, it's called PCR, or polymerase chain reaction. Basically, they're magnifying the virus genome or the virus gene and trying to magnify it and then check and see if the virus is present in certain people. That's the test that is run. And from what I see, different companies running this test, they have different ways to run this test, but PCR tests in general is supposed to be very sensitive, higher than 80% sensitivity. If it goes over 90%, that's even better, because we want our screening test to be very, very sensitive, right? We want to include all the people who are positive. And that's the one test that is available. And different labs have it. LabQuest, has it, and the other lab, Quest Diagnostics has it. Those two are the main commercial labs that are available. But if you go to these, if you are highly sick and if you go to these hospitals and in the emergency room you get tested, they can also run their own test. Baylor has its own test. Texas Health is running its own test. And now we have this new 15-minute test available by Abbott Labs that is back in 15 minutes. So it tells you in 15 minutes if you're positive or negative. And that's another swab that goes in your nose as well. So that's one kind of testing. The second kind of testing that people are, and you must have heard in the news as well, is the antibody testing. And that's the testing to look for acute and chronic antibodies when people have been exposed to coronavirus. And that testing is, in my opinion, more useful for, epidemiologic purposes as people get exposed and people want to get back to work. These antibody tests can be done to see if they're okay to get back to work. If their chronic antibody test is positive, that tells us that they may have been exposed at some point and they should be okay to get back to work, although now more and more information is coming out that we need to first establish that the chronic antibody levels mean that we have immunity against the virus. So it's a complicated answer, but in general, screening test has to be a nose swab or nasopharyngeal swab, and later on down the road when we need to screen to see which people can get back to work, that's the antibody test.
Excellent, thank you. Dr. Gurapu, a lot of people are confused about the precautions they need to take. We are seeing people on Amazon going on buying this mask, creating the scarcity everywhere, and the cloth mask. So what is the best way to prevent, especially if somebody has to go out, what is the best way to prevent?
So the CDC actually, there are guidelines in CDC showing that, normal person, like as long as they're maintaining the social distancing, basically, we don't have to be really, they don't have to wear a surgical mask. That's purely for the, healthcare professionals, So the cloth masking is one of the thing we can do that, like, at home actually, like, there are like a certain fiber actually, like a cotton, it has a very good protection, and most most of the people, they are doing their own mask at home, and which is good enough to protect ourselves. But only wearing the mask is not enough to protect us, getting contact. We have to maintain the hand hygiene, number one, and washing the hands and not touching our faces, with the hand any time, like, when you, and again, always the social distancing, like 6 feet away from everybody. So combined with the mask, all these things has to be done all together, to protect us. Only mask doesn't help us,
And a lot of people only have one mask. Can they reuse that mask?
Depending on, like, a cloth mask, there are a lot of washable cloth masks are available right now, which are good. You can just get in and, you can reuse it. Unfortunately, like healthcare professionals, we don't have like enough masks. So what most of the hospitals and physicians are doing, they are reusing the mask, like especially the N95, wearing, like, on top of the surgical mask. Surgical mask, we are reusing like every third day or fourth day, something like that. So whatever we have, resources, whatever we have right now, we have to reuse them. Like for me, example, when I'm seeing the patients, sick patients, when I'm seeing in the clinic, we are also having a very limited, gowns and very limited like mask, right? So there is no choice other than reusing the mask,
Excellent. And how about, obviously if somebody wants to travel by car or by plane, what kind of precautions they need to take at this time? In the travel in the US is not restricted, but of course they're not traveling to Bharat at this time. How about just traveling outside to other state or other town within the country?
For Dr. Dugal or for
Dr. Dugal, go ahead, please.
I don't know if she was going to answer. I'm sorry.
No. Go ahead. Yeah.
So travel, if you're traveling first of all, CDC has put out some guidelines for travel as well. So they're saying, if you're not feeling well, if you're feeling feverish at home, you should avoid any kind of travel anywhere, okay, by air or car, it doesn't matter. If you're feeling okay, they still want you to limit your travel to prevent you from getting exposed to someone else who is asymptomatic and is traveling. This is the most common scenario in an airplane. Most of the air is filtered out in the airplane, so you should not get, all the passengers should not get sick if one person is sick. But if you're sitting close to that person, if you're not 6 feet away in the plane, you're likely to get sick if they have the infection and if they're asymptomatic. So that's the reason airplane travel would be risky, in my opinion. If you don't have to travel by air right now, even domestically, I would say avoid it. Number two, if you are traveling by car, if it's your own car, and if you're not going to stop at 5 different gas stations on the way to Houston, you should be okay. If you stop at a gas station, then you need to do all the precautions. You need to wear masks. You need to hopefully have gloves on. If you touch something, if you buy something, if you get gas, and then dispose off those gloves as well after you're done. And if you're traveling by train or by bus, I think that's another risk that you should not take if you don't have to, especially if you're taking public transit and all that. I think that's another risky place. You would need to be very careful that you need to be at least 6 feet away from the next person. And if you are traveling, you have to wear hopefully your mask and your gloves as well to make sure you don't contaminate your hands and then accidentally touch your face or your nose and then acquire the infection that way.
And Dr. Dugal, I think the question again to you. If somebody got an infection, is there a chance of another infection?
That's a great question. Right now, from what we see, WHO came out with a statement yesterday that, even if you have the chronic antibody in your blood, which indicates that you've had the infection before, you could still get the infection. That's what they said. And then they quickly rescinded it because then people started freaking out saying, what about, if people have been infected in the past, then what happens? So today they came out with a disclaimer and or additional comments saying that right now the data suggests that you should have immunity to the coronavirus infection for at least the next few months, if not for a longer time after you've had the infection to begin with. In general, if you look at the immunology of any infection, if you develop antibodies against the virus and the virus doesn't change its structure, that's the most important thing. You should be immune to the virus going forward. This virus is not known to change its structure. Coronaviruses have been present for many, many decades, even centuries, and they have not been known to change structure. This is the first one that we have seen in a long, long time that has done it. And the origin of this is still to be established. All these theories about what's going on in China and whatnot. But the bottom line is, it's not like influenza. Influenza or the flu virus changes its structure so commonly. That's why every year you have to change the vaccine to the most common strain present in the prior year. So hopefully this virus, we will not have to worry about that.
Dr. Gurapu, I think you might have had some patients calling you for some preventive care. At least I had few patients who asked me, can I get hydroxychloroquine just to have it in my closet as a precaution? Is it worth taking hydroxychloroquine as a precautionary measure if you just have fever but no other symptoms?
Definitely, I would not suggest that at all. As I said, the CDC is not even recommending hydroxychloroquine as an outpatient setting. But, it's again, hydroxychloroquine, there is no clear studies are showing that, okay, you have to go ahead and treat it. Since the risk rate, cardiac risk, especially the heart, arrhythmia and sudden death, because of the arrhythmia is high in using the hydroxychloroquine, physician has to be really selective. In fact, for me, actually, my patient was not getting positive after the third test also. So then I have to discuss with my ID colleagues and then decided to go ahead and start it as an outpatient since the patient is younger and doesn't have any heart problems before. That's the only scenario I have to start it. But prophylaxis, no for no.
Right.
Never.
And at least there is no vaccine at this time, right?
Yes,
Exactly.
definitely.
There is no vaccine. I want to add on to this real quick. I think that's a great point. Outpatient, there is no indications for using hydroxychloroquine at all. If you're not sick enough to be in the hospital, you don't need to be treated with hydroxychloroquine. Number two, whatever limited data we have on hydroxychloroquine, azithromycin, and zinc combination, that's the most common combination I've seen used in the hospitals. It's very limited. There is, there's conflicting reports, conflicting data that it may or may not help. But I agree with Yamuna that they need to be checked for any kind of cardiac issues. They have their EKG checked to make sure their rhythm is not rhythm is not bad. And number two, we need to make sure that they don't have any medications that they're taking which would contraindicate hydroxychloroquine or azithromycin combination. So at this point, I agree. There is no set treatment that is beneficial, but the most important thing is we choose patients based on the way they are and then treat accordingly.
Dr. Gurapu, so we are now almost like 4 weeks at home. Most of us are like already suffering of staying at home. What is the best way to keep ourselves fit, both physically, mentally, and in terms of sleep?
So as I said, I would say a little more spirituality. I'm just kidding.
So a little bit of yoga and meditation.
Yes. So I agree with you because in fact, I am treating depression or staying home depression for some of my patients. Anxiety and depression because of their staying home with the kids and cannot handle it, not sleep very well. So I'm like, no matter how much I'm telling, they're like, no way, I cannot handle this stress anymore. And I have to compare them like, let's say if you're going and working with a COVID patient and getting exposed is better than handling the stress at home. Some patients are, no, I think that's better, staying home is better than, So, but the question is like how we can motivate ourselves at home. Definitely we need to start doing the physical exercise at home, like including meditation versus 30 minutes brisk physical activity, especially like a treadmill you can do, elliptical you can do, and if nobody has those equipment at home, you can do stairs actually. At least make sure you have some time and good sleep. The sleep is such an important thing. 8 hours of sleep is really kind of detox all our stress for that day, and we can recuperate from all the physical and emotional strain, and next day you can start your day really fresh. And hydrating is good, like taking a healthy diet is important too. And as I said, distraction from all these emotional stuff is important, and there are like online um, sites are available which are kind of help you to relax, and some breathing techniques are available. And worst scenarios, as I said, we have counselors, they are doing the televisits, we can refer to the counselors for that. And worst, like the last thing is, again, medications are also available. But for us, the community, actually, we are a good community in Frisco. Most of them are trying to cope up with the staying home stress and doing really great job on that,
Excellent. Dr. Duggal, what is the best way to improve our immune status? I think this is not going to be the end of the story. We may have one more outbreak 4 years or 5 years, whatever it may be down the road. What is a good way to bring our immune system into shape?
So most of the things that we see, when we nothing has been studied for sure to help specifically with COVID. But what I see, being used is vitamin C because of its effects on, any kind of viruses. If you have common colds, rhinovirus or other viruses, vitamin C is supposed to help. So it's a water-soluble vitamin. You can take adequate vitamin C either in the form of natural like oranges or orange juice, or you can take a supplement and have enough vitamin C. And you can never have excess of it because you'll be able to, it goes through the urine and comes out. So you don't have to worry about getting overdosed with vitamin C. Number two, any kind of B vitamins, are helpful as well. B1 is thiamine, that's helpful. Vitamin D is helpful to boost up your immunity as well. And then they talk about zinc because we use a lot of zinc in combination with these medications. Zinc also has very good anti-inflammatory properties. In general, eat a healthy diet, as Dr. Yamuna said. Eat a healthy diet, and also try to, if you're not taking a multivitamin, it's not a bad idea to take a multivitamin because it gives you all the additional vitamins that you may be deficient in, minerals and everything else that will help to keep your immunity at pace.
And I'm suspecting this disinfectants and this radiation therapies are not going to help for sure.
Yeah, please. I don't even want to quantify that. Please do not read into this. And I know I was looking at CNN today, and they said the governor of Maryland he said on their hotline they were getting so many calls of people actually asking if they could inject or ingest disinfectants, and they had to tell them, no, please don't do that. But I cannot even believe people are calling in to ask that question. That it needs to be completely eradicated.
So yesterday, day before, I was talking to one of my patients, and she was talking about getting some Lysol, and she's genuinely asking the question. She says, I heard somewhere, means I did not read the news at that moment, but the patient was asking me, I was told by someone that I can get Lysol and cure the COVID-19. I said, where did you get this one? Please don't do that. But I did not know who said that. But I researched after that, then I found where did this news come from. So yes, disinfectant is not going to help. Ultraviolet radiation is not going to help. Period.
And disinfectant, in fact, can damage your esophagus or your food pipe, your stomach. It can create holes in the stomach or in the food pipe and cause significant damage. So I would not even, please, whoever's listening, please do not even try to do that.
Excellent. Srikantji, any questions on the WhatsApp?
Yeah, from audience, we are not picking up any questions.
Okay. So do anybody else has any questions or any comments?
Ram might have some.
Well, yeah, I do actually. I think.
Go ahead, Ram.
Yeah. So I think this is from the data perspective, right? If you look at our city of Frisco, which is still considered very young city, the average age is around like 38. Okay, for the city of Frisco, and over 65, which is actually senior plus citizens, that's only 9%. So my question to all the doctors here is that the reason that because city of Frisco is young, that we had a very low coronavirus? I'm just curious, from an age perspective.
So can I go ahead and answer quickly?
Go ahead, please.
Yeah, please.
So I mean, I agree the age group is really important to kind of look at the severity of the disease, but age is definitely an interesting factor, but we need to look at the comorbid conditions like, blood pressure, diabetes, and immunocompromised patient like HIV, and patients are on like a rheumatoid arthritis being on medications. And those ones actually I'm seeing a lot of younger people only. So I'm not sure the age, we should differentiate only the age factor in Frisco. I mean, there are, and obesity is one of the biggest problem too, and it's documented that, these comorbid conditions increase the prevalence and also the mortality in COVID-19 patients. So unless we have a better data on that, depending on the cases and look at them, who are the ones actually got in, like my younger patients, one doesn't have any, but one patient has a terrible blood pressure issues actually. So that could be the reason he was like prolongingly getting positive. So we cannot just consider only the age in my perspective. I don't know what Dr. Dugal said. What do you think, Dr. Dugal?
I agree. I think age is one of the factors that would be considered in risk as far as risk of getting the infection or complications from it. But, as Dr. Gurappu was saying, even in the hospital, we see some patients come in sometimes who have no risk factors and who are below 65 years of age, who do get extremely sick. In fact, 2 weekends ago when I was on call, this was not in Frisco, but I went to a Methodist hospital in Richardson and I saw a patient who was completely fine, 51 years old, and he became sick in a matter of 12 hours. He had to be on the ventilator in 12 hours from the time that he presented to the hospital. So that happened so quickly. And, again, there still needs to be a lot of studies that need to be done to look at what exactly triggers this infection to become severe in some individuals and not in the others. That's the key.
So, Dr. Dugal, I think this question from the audience we answered, but how do we disinfect a KN95 mask or any other mask for reuse?
I think there's, if you look at the outside surface of the mask, the K95 mask, you need to make sure that the filter does not get moist. So that's the most important thing. The filter that is in the mask needs to stay dry. So you can use a a germicidal wipe to wipe on the outside surface of the K95 and also gently on the inside surface, but most importantly the outside, and also the strings that you use to wrap around your ears or you tie around your head, because those are the most common places where the virus would stick to if you ever were exposed to anybody who had the coronavirus. So any kind of germicidal wipe, very gentle disinfection to make sure it doesn't get wet or moist is the key.
And another question, Dr. Gurappu, I think here's a question. Is it safe to get to-go food from restaurants? Is it safe to go there?
As I said, for some time, delivery-wise, I would say for some time I would like to avoid that because still we are learning, we are having a little bit of community spread going on. Right now, the cases are getting stabilized. The Frisco actually, the peak cases were noted on April 8th. After that, the cases are being really stable. So I would avoid at least for next 4 weeks and see the trend. I mean, we have to plateau and make sure that we are stable enough. And then, you can probably start exploring going outside. And again, the same rules apply, the personal protection rules applies always. But for now, just, try to avoid it, like, eating outside for now.
I think there's a question here, more than 75% recovery rate in Frisco, and what is the doctors here doing different compared to other cities? I suspect the population here is more healthier or younger, and that's why the recovery rate probably is better. Dr. Dugal, any other opinion?
I think that is correct. I think that probably plays a big role in this. And I don't know the data off the top of my head or how many patients out of the ones that were affected in Frisco ended up going to the hospital. That'll be interesting to see, what is the number. But I suspect the number is going to be very low. and that's why a lot of people recover, because the age is on their side. Plus, they may not have any other comorbid conditions. Diabetes, high blood pressure, COPD. All those things probably are not there. So probably that's what's helping them to fight the infection off.
And I think the last question to plan. If I have to, if I plan, 2 more minutes. Okay. If I plan,
I have a couple of questions to ask.
Okay, go ahead, please.
Yeah, we had a WhatsApp message. So what kind of timeline are we looking to get the medicine? Like 1 to 2 years?
As far as medication to treat the virus, there's still studies ongoing right now. We will get more and more information from New York, where a lot of these studies are going on, and because the highest number of patients were in New York. And we should get more data about treatment sooner, but I think vaccination would still be a year away. 1 more year at least minimum for the vaccine.
So how better is the hydrochloroquine? Like we so much of hydrochloroquine from India, right?
So yes, so it's very commonly available in India, but as I mentioned, hydroxychloroquine is not shown to be, whatever the recommendations are right now, or any kind of treatment for coronavirus right now has to be under a study protocol or in some sort of trial. Because when we use it for patients, we need to make sure that they're used for, and the patients can be followed longer. They can be screened and followed for any sort of complications down the road. Remember, the half-life of this drug is 22 days. It can stay in your system for 22 days. So even if you treat for 5 days and be done with the treatment, the drug will be in your system for almost a month from after you're done. So that's why we need to follow these patients and see what happens to them, and everything is okay with them. No major side effects or no other problems happen to them.
Dr. Guruppu, I think this is an interesting question. Is there a risk of spread from shoes?
Absolutely. So there was a study from, I looked at the study from China. I don't know how much to believe Chinese studies, but still, whatever the data was that if you are, most of the hospital workers, especially who went to the ICU to see sickest patients, their soles of their shoes had a high amount of virus. They tested the virus in the soles. It was there. So when you come home, if you wear shoes at the hospital, your shoes should be on one side and should not be intermingling with other shoes that are in your in your shoe rack, or ideally you should put them in the garage to make sure they stay away from your other shoes that you wear.
And one more question, Dr. Dugal. Like one of the friend Yad Senapati is asking, can he do the travel via bikes? He has got some travel plans pretty soon.
Travel via what? I'm sorry?
Travel plans using flight. He was asking, can he do the travel?
So as I mentioned, if it's essential travel, he needs to make sure that, from the time that he leaves his house to the time he gets on the plane, anything that he touches, he needs to be very careful. Maybe take some hand sanitizer with you and make sure you wipe your hands after you touch everything at the airport. And then secondly, when you're sitting in the plane, you have to be careful that you sit at least 6 feet away from the passengers that are around you. Most of the flights right now, from what I've heard, they're not full. So you should be able to sit farther away from other passengers. And if you want to be safer, you can wear a mask as well. And most of the other passengers probably will. So that way, they will not transmit the virus even by mistake to you. And you do the same thing. You wipe your seat down. You wipe your table down in the plane, and then when you get off, do the same precautions when you leave.
I mean, for Dr. Yamunagaru, from the women's standpoint, do you have anything to suggest them? Like what precautions?
Yes. Before actually I answer this question, I want to share a very quick thing actually about the travel thing too. I just wanted to share a interesting one. One of my patients actually traveled a couple of weeks ago to Kansas, and the flight is only 2 passengers. And one passenger crashed with shortness of breath, and she is back to positive COVID, So the other patient, we have to quarantine her. So as I said, Dr. Dugal said, I think we need to be very careful if it's like an essential travel plan or something we really have to go there. Just have to decide about the priorities, and protection is important. Coming to the woman perspective, so far the cases reported actually, we have, the males in Frisco, actually I'm talking about, the 49% of male and 47% of female got infected. So I don't know, like this one, I don't think, it has a discrimination. The COVID doesn't have a discrimination of female and male, I guess, So far, the data is showing. But there is a small difference, compared to the males are little more prone, I guess, compared to female. We don't know why, but that's how the cases got reported.
Any other questions, Srikant?
So from the women's standpoint, you said you are going to answer, right?
For women, I mean, pretty much the pregnant women, lactating mothers, and everything. The care of the treatment care is pretty much same guidelines we follow so far. We don't have any set of rules for women. How do kind of what is the treatment for so and so particular stuff. So far, we are just following the same old rule, protection-wise, medications-wise also, and lactating moms also the same thing, The one more thing I would suggest for everybody, actually, please do not take all these the steroids. Like, the patients are calling me, hey, I'm getting some cough, maybe I'm having some allergies, can I have a steroid shot or something, can I have a prednisone prescription? So I think, with this pandemic, definitely we have to avoid the steroids. Probably like ibuprofen, Motrin, unless it's really necessary. Those are the two things for us.
So kids can wear masks. Right? Kids can wear masks.
Kids can wear masks?
Yeah.
Yes, definitely. It applies to everybody. The kids that are going outside, mask, hand washing, everything pretty much same.
So, I mean, after the markets open up, pretty soon the markets are opening up, right? So the precautions should be the same, like having
same precautions, yeah, same precautions. And only thing is, the main thing, the difference actually as a woman perspective is the pregnant women, we do test more just to make sure that, they are kind of little immunocompromised status because of the pregnancy, right? So some of the places actually, they make it as a mandatory testing COVID on pregnant patients, regular women, premenopausal, postmenopausal women, everything pretty much same.
We have one quick question. This is related to the testing. So right now from the data we collected, it's like if you're tested by a healthcare provider or a private lab, and if they test positive, right, you'll be still tested by the government facility like a CDC or a local health department to confirm. Then there is that, I'm sorry, like, just wanted to come. So then then they have to receive 2 more negative tests to be released from the quarantine. So basically it is resulting in 4 tests before somebody who is positive to be released from quarantine. So the question here is that, is that true? The second thing is, do we have any testing scarcity, especially in state of Texas or city of Frisco?
So,
yeah, so I think the most important thing, oh, go ahead.
Just a quick thing and then you can take over. Most of the testing centers we are doing in Frisco and, Collin County or Texas area, they are automatically getting reported to the, healthcare department, and which subsequently they are reporting to CDC actually. I don't think, we test it here and then the CDC testing. That's not true at all. And the positive, when patient is positive test, then only we'll do subsequent 2 negative testing. That's about it. And once the patient is negative tested and he's stable, no other symptoms are there, well, after the quarantine, we will clear the patient actually. And you can take over, Dr. Dugal.
No, I think that's correct. So what you're saying, Ram, was true when the initial test started in March, when the tests were not validated by the CDC and they were not FDA approved. But most of the tests now that the hospitals run or these labs run, the private labs, they are FDA approved now. So they don't need to be tested again by the CDC or the state or the government to validate it. So the test that is run initially would count. And then obviously once your symptoms are done, then you can be repeat tested. But even that may change now because, as I mentioned, the antibody tests are coming out, and the antibody tests will be much better to show in 2 to 3 weeks, if you develop immunity against the virus, and then you should be allowed to get back to work based on the antibody test, which is a much better test to allow people to come back to work.
Okay, thank you so much for clarifying. It was confusing to me. So thanks both doctors, appreciate it.
Dr. Dugal, there is one question from the audience. Like, is it okay to go out for walks and outdoor activity? Do the doctors have any info on the airborne nature of the virus?
So yes, so it's okay to go out for walks, yes. And when you do go for a walk, they talked about this in detail, in one of the news telecasts that I looked at, and they showed if I'm talking to somebody normally like this, the virus can go up to 2 feet, okay? But if you're walking or if you're running, and if you cough on somebody because you're running, the air can transmit the virus longer to a longer length, about 10 to 12 feet as well. So you have to be careful when you're walking. You have to maintain social distancing. When you come close to somebody who's crossing your path or somebody who's walking aside you or they get next to you, you have to make sure that you're 6 feet away minimum to make sure you don't contract the virus that way, because that's a very, very common way to get it if you are not careful.
So, yeah, pretty much my questions are done. Sunil?
So, Dr. Duggal and Dr. Gurappu, I think this will be the last question. Somebody is asking, what is your take on what is happening back in Bharat? I'm not sure if you have any good idea there, but if you have.
I think I've seen some reports in India. What's going on there. First of all, India is doing a great job in cutting down or curtailing the spread of the virus, because as you know, the population is large and the efforts that are being done over there are very well documented. As long as they keep the viral infection, the clusters in a smaller area, that's the key, because it can spread very quickly to others. The socioeconomic status plays a big role in a country like India. If the virus gets into lower socioeconomic strata, it can spread very fast. So I think they're doing a good job so far in at least controlling the virus as far as I can tell.
Is this BCG vaccination helping at all? Like, there is a lot of talk on BCG vaccination being...
That's a great question. So it's been shown in a few studies, and there was a researcher from Germany who recreated this, and they had a BCG extract that they gave to some patients who did not develop complications from coronavirus infection. And they are postulating that this may be the case, that whoever has been vaccinated by the BCG vaccination, their immunity goes up because they develop antibodies against TB. And that builds up their immunity, and that somehow fights off coronavirus infection in those patients. But again, this is very early on. There's not too much clarity on this, but that's definitely one of few reports that I saw.
Okay, so
Wow.
Ram, you have any question?
No, I think the last question, I know that we want to respect their time too, right? Because it's Sunday night. So the only thing is I know that I was actually asking about the testing. So do we still have a shortage of testing in our city and state? Because yes. I know New York is still backward, little on the testing side, So go ahead, I'm sorry, Dr. Gurappu.
Yes, absolutely. The testing capacity got improved compared to last 3-4 weeks, definitely, and we have more testing centers are available right now, but still lot of selective testing we are doing actually. In fact, there are certain things to qualify as an outpatient setting. Even the inpatient settings also, maybe better availability. For example, when I was rounding last month in Presby Plano, when we do a testing, the results were coming in 7 days. It was taking 7 days. And now actually rapid test kits are coming on the same time. The resources we are using better right now, but still there are a lot of testing deficiencies. They're not like a flu, like we do it very quickly. It's still deficiency there.
Dr. Dugal, there is one question from Ramesh. He's asking, what is the difference between why in India the fatality rate is lesser than US?
I don't have a clear answer why the fatality rate is less. But I wanted to go back to the testing real quick, and I wanted to mention that Texas does have the least number of tests available. I'm talking about both nasopharyngeal and antibody tests out of anywhere in the country. So that we're seeing that because we're seeing patients in the hospitals. Because most of my patients are in the hospital. We are seeing deficiency of tests in the hospitals, and we are being very careful in testing specific patients who are high-risk patients, even though we isolate others if we suspect they have the infection. So we are struggling from that aspect in the hospitals as well. And I wanted to make one more point, before I forget. I know that we are all curious to everything needs. We're trying to get back to a normal life. But whenever that happens, whenever the governor picks up these orders where there will be relaxation of the stay-at-home orders, I want everybody to please make sure still maintain your 6 feet distance. Still don't go into crowded settings. Don't go crazy going into malls and restaurants and crowding these places up, because that's where we will get the second spike coming up. And I just want everybody to be careful, because I don't want us to be dealing with our friends and colleagues getting infections and then we're trying to figure that out.
So you don't want us to book a flight ticket to Bharat in December at this time?
They won't let you come also, I guess. Even though you go from here, they will stop you over there.
That's true. Yeah, I don't think there is any flight going to Bharat right now, but to plan in December, is it a realistic plan to book a flight ticket now for December? I'm a little bit skeptical. I don't know.
As long as it's refundable.
Yeah.
Excellent.
So, pretty much this will be the end of the call, right?
Yes, Srikant, I'll just wrap up. Thanks, Dr. Duggal and Dr. Gurapur, for helping us today, for answering all these questions. It was really helpful for all the community members. I also learned a lot. As a neurologist, I treat neurological cases, not specifically related to COVID-19, but a lot of crazy questions I get, headaches, back pains. Is it COVID? No, it's not. But yes, it helped me as well. Thank you very much.
You just have to tell them to call your primary care doctor.
Exactly. Exactly. That's what I will do.
Before we leave, we have small information from Vishnu. Vishnu is online. Vishnu, you want to go ahead and give the information from Seva International?
Sure, Srikant. Yeah. Hi, everyone. Can you all hear me? Srikant, can you hear me?
Yes. Can hear you. Yeah.
Sorry, I'm not on the video. Thank you so much for all the doctors and the speakers who have provided, such a wonderful information. It was a lot of useful information. I know all of them personally except Dr. Duggal. And once again, thanks to all the, valuable information that you guys have shared. I would like to, just spend a couple of minutes or very few minutes, just to share a few things that, what we can do as a community while we are fighting, the COVID-19, war during this situation. Fortunately, hopefully everyone is, on the call and the families are doing well. And fortunately, at least, from what I know, all of us are, in this group. Not necessarily everybody on the call, but I know have been closely associated. All of them are good. And with that, I just want to see, how we can, be good, helpful to the society while a lot of people are suffering. And I just wanted to introduce one of the organizations called Seva International. Seva International is non-profit organization working in the service of the community whenever there's a huge, it doesn't have to be huge or, small, right? Any time of the need, Seva International is always there. And it's been a larger movement that has started back in India in 1989, but Seva International is headquartered in US and it works internationally. So just wanted to go over a few things, what Seva International has been done during the COVID-19 at a high level. I'll spend maybe 30 seconds, 1 minute, and just read it out at a highlights, and then I'll show a couple of opportunities if anybody is interested locally to contribute. So Seva International has been, very active on COVID-19 fight since last 7-8 weeks in US. And we have 2,500 volunteers engaged in COVID-19, and 800 plus organizations have been associated or rather working together, nationwide. and mostly organizations that are connected to somehow or the other India. Roots are in India, but they are all from US, right? And then there are 60 plus plasma donors, 19 recipients, 4 patients served via online plasma registry, and 50 plus organizations mobilized for support local food banks, and $500,000 has been raised, and it's currently actively being spent. And there are 8 helpline centers, 24/7, catering various aspects of the community or the different areas of the community where the need is there. And 200 plus volunteers have been trained to take care of these calls. And 150 international students, 600 plus food deliveries have happened already, 50 plus family services are. And then 50 plus physicians and attorneys are helping on these, the calls, helpline calls. And one last thing is that just like what this webinar is conducted, similarly the Seva International has conducted 67 webinars connecting 75,000 users so far, and there are 50 awareness campaign posters that are going around on the WhatsApp, and these 8 helpline centers are always available for anybody. And just wanted to bring up the local Dallas community, what we are doing here. Locally, we have connected with, many organizations also, as that 800 number is also part of local community where we have 30 plus organizations connected. And we are all working as, sorry, is somebody saying something?
Even Bharati too, Bharati Foundation also.
Oh yeah, Bharati Foundation, including Bharati Foundation. And Srikanth also, when I connected with him 4 weeks back, he showed a lot of interest, and I'm sure, there's a lot to come through Bharti. And I think there was one question, somebody was asking, mask making, and our Dr. Gurapu was saying we can probably do, instead of using the surgical masks and, N95s, can we do some cotton-based homemade masks? We have formed a group here locally which has all the details how to make the masks, and a lot of people are contributing in terms of making the masks, and some of them are contributing in terms of providing the material. Right? And the second thing is we have worked with McKinney City, and McKinney City has started this portal called OneHeartMcKinney.com, where the needy people will go and register as some need for them, whatever the need could be, and providers like us can register there as a whatever the service that we have. So we have registered as a food donation organization, and we are serving hot meal to individuals. Starting this Saturday, coming Saturday, we are donating 100 meals to start with, and people will come and pick it up. But it will grow eventually, and next 8 weeks we committed for that. And anybody in the call, I'm not asking for any fundraising or anything here. But there are a lot of opportunities that we can all be part of while, a lot of community is suffering. It's not just the direct impact of the health, but there is a bigger impact in terms of economy, and a lot of people are at home who are not able to, earn their bread and butter. So I think if we are in, at least if we are on the next level where we don't have that problem, I think if we can all step up as a community and be there for one another, I think that will be a great opportunity for all of us to be part of the society and give back to the society. And I will stop here. Thank you so much for giving this opportunity to share with everyone. If you have any questions, if you want to be part of any of the Seva activity locally or anywhere, and if you have any of your friends who are interested, please contact me if you know my number. Otherwise, Srikanth will be able to route it to me, or even Dr. Tumala is also very much involved in this.
Yeah. So thank you, Vishnu. And here is the conclusion. Thank you all for joining the call, and we'll have more of these calls in future too. Please stay tuned. I really big thank to all the doctors who open-mindedly joined this call. With just a call, you said they are going to be there. Thank you so much, Mr.
You're welcome.
Yeah.
And thank you, Shrikant Garu and Dr. Tumala, actually good questions and coordinating all these things. And Anuragji, thank you, and I learned something from you, definitely, new stuff. Thank you a lot.
Likewise. Thank you so much. Thank you.
Ramji, thank you so much for
Thanks,
joining.
everyone. No worries. Thank you. Appreciate it, guys. Thank you, doctors. Bye.
Thank you, doctor.
Bye-bye.
Bye.
All right.